It's a great pleasure to be here to welcome you to this public discussion and dialogue around the issue, the work of the panel.
Between both. What patents are rewarding is anything that is new and inventive in whatever way you want to describe it, but it's not linked to actually proving that it will improve health outcomes. And this is a fundamental problem. This is why we have over 70% of the new medicines that are brought to the market that have zero therapeutic value compared to what we have already.
If we had in India today's laws way back in 2000, I guarantee you 10 million people more would have died in the period 2000 to today. So we have to face issues of life and death, access at affordable prices, and that none should be denied medication.
You talked about transparency. Yes, actually the whole system of R&D is shrouded in secrecy. So the biggest elephant in the room is the cost of R&D. There is no transparency about that cost.
We need to realize that in Europe today, the main obstacle between a patient and her or his treatment is the price of this treatment. And it's happening today in Europe. Thousands of Europeans across the continent, we see that even in the wealthiest of member states, countries are forced to ration. So the slightly sick are excluded until their condition seriously deteriorates.
So in France, for instance, we made a calculation to make the new treatments of hepatitis C available for people who need it now. It would take up the entire budget of Paris hospitals. So how sustainable is it for health systems?
I think the public investment today is not giving sufficient public return, and strings need to be attached. I come from a country, Spain, where in 2015, the hospital pharmaceutical expenditure increased 25% in 1 year.
We've seen that where the conditions that were agreed upon within TRIPS are strengthened and added to, access gets worse, prices go up, health outcomes drop. Very, very simply, we should have a moratorium on any inclusion of TRIPS plus conditions within any trade agreements.
Should be a strong recommendation from this panel against the push, not only against the TRIPS plus measures, but against the retaliations and threats in the legitimate use of the TRIPS sensibilities.
To reject ratifications of the TPP, so in the middle of the process, and also call other countries not to join the TPP. Well, these rules which can be harm the right to health.
By a pharmaceutical company, Eli Lilly, that is suing the Canadian government under the investor-state provisions of the existing trade agreement between Canada, the US, and Mexico, challenging a decision by two courts in Canada applying those well-settled principles for validity of a patent because they actually haven't delivered what they promised in their patent claim. The investor-state provisions of NAFTA are being used to bring an unprecedented challenge against the government of Canada to overturn that decision effect and rewrite the standards of patentability in Canadian law. And now those very same sorts of provisions are at risk of being replicated in the TPP, globalizing that threat further. So I think it's important when we talk about working within the existing system, even those somewhat difficult to use flexibilities that ostensibly exist on paper are under sustained attack, and that attack is growing. And I think it's important for the panel to make a strong statement about that point.
And in terms of the policy solution around it that you would see?
Yeah, don't do it.
Okay.
Because of course the deep frustration in all of this discussion so far is we're staying within the existing model, which is a model that has continually failed patients and will continue to fail patients into the future. It's not enough anymore just to tweak around the edges. We need some fundamental changes.
When TDM1, the drug that Dermot talked about that's not reimbursed in Scotland, because it's £102,000 a year in the UK. And it's too expensive, even though it's effective.
I'm going to talk not from my perspective, but from the perspective that we haven't heard enough of today, from a patient perspective. In the UK, access to very, very effective breast cancer treatment, a drug called Kadcyla, made by Roche, is not typically available on the NHS because of the price. One of the richest countries in the world, one of the, by some metrics, the most effective health system in the world, can't afford the prices that are being charged for effective medicines anymore. And Carolyn, a patient in Wales, had to go to her neighbours and get them to fundraise, running community fairs, holding charitable auctions, doing sponsored runs to pay for her treatment week after week. month after month. It's totally unsustainable. And that's happening right here in one of the richest countries in the world. And unless we have some methodology for putting pressure on prices so we can curb these like hyperinflationary prices that we're seeing, our health system, I fear for its future. I worry about the future of the NHS and how sustainably we're going to be able to finance it in the future.